Hi, my name is Dr. Mark Frank. Welcome to my introductory video. I am here to help you get the health that you've always desired and wanted. I've been in private practice in Zephyrhills since 1981. Since that time, I've taken hundreds of hours of postgraduate training in nutrition, neurology, and holistic methods. I've been a certified health coach since 1995. Your needs may be as simple as a strain from overexertion on the weekend, or maybe you're suffering from a herniated disc that a doctor has given you an opinion for surgery for, and you're looking for an alternative. Maybe you've had fibromyalgia or chronic fatigue or a thyroid disorder that hasn't worked for the last 20 years, and you feel like there's no hope. I'm here to tell you that there is hope, and we will leave no stone unturned getting to the root cause of your problem. My hope is that in this video you will see that you're a whole connected person, and the way that you eat, that you move, and that you think affects dramatically your pain and your health. I know a secret. Your body is an incredible healing machine. Regardless of the name of your disease, your body knows how to get better if we can just figure out what's stopping it from getting well. There are three different types of stressors that your body has to deal with at all times. These are structural stressors, chemical stressors, and mental emotional stressors. Structural stressors are the type of condition that chiropractors excel at. These are things such as whiplash, falls, and bad posture. We have multiple different types of treatments that we use for all of these conditions. Obviously, senior citizens and infants will require a different type of treatment than athletes do. There are many different types of chiropractic therapies. There are non-force instrument-based adjustments. There are traditional manipulative type of therapies, and there are Cox flexion distraction type of therapies geared towards disc problems. I will examine you and determine what type of treatment you will best respond to, and we have a team of professionals that will help with massage, physical therapy, and rehabilitation. Chemical stressors are what I am excited about the most, because this is where I feel chronically sick people can really regain their health. Chemical stressors are things in your lifestyle such as too much sugar, lack of essential fatty acids, too many trans fatty acids that cause problems, unnecessary bacteria in your gut, parasites in the GI tract, chronic molds in the GI tract, insufficient amounts of the healthy bacteria that produce vitamins for us. So in the past, chemical analysis of these stressors was very difficult to do. But we have now modern laboratories that excel at these kind of things. Labs such as EnteroLab, which specializes in measuring your body's reaction to 5 classes of foods that you're probably eating every day that are leading to inflammation and pain. Metamatrix Laboratory, they specialize in measuring your body to see if there are unwanted pathogens such as bacteria, viruses, molds, and parasites living in your body and producing chemical waste that are making you sick. Diagnostic Labs is another lab that specializes in measuring your body's reaction to stress. We give you a simple kit to take home and do a saliva sample 4 separate times throughout the day. We're looking for the level of your cortisol throughout a 24-hour period. In a healthy person, your cortisol is highest in the morning and it goes to the lowest point in the evening. That means that when you wake up, you have the most energy, and when it's time to go to bed, you're naturally ready to fall asleep. Many times in chronically ill people, this is reversed. So when we combine all of these different laboratory methods and a complete history and physical exam, now we have a picture of the whole person and we can really make a comprehensive plan to allow you to get well. I have 3 pieces of equipment that I'm excited to talk to you about. The first, the Cox flexion distraction technique, is an exceptional table for acute disc herniations or disc bulges, which were conditions in the past that we were unable to help and which generally went on to surgery. The second table is the 3D Active Track by Saunders, which is a decompression table designed for conditions such as stenosis, osteoarthritis, or chronic disc herniations. This is a fantastic table. It works exceptionally well for older people, which again in the past we were unable to help with those types of conditions. The third table I want to share with you about is the Pedibond PTLMS, and this is a decompression table designed for the neck or the cervical spine. Is exceptionally helpful for patients with neck and arm pain or headaches. Again, in the past, these were unable to be helped and these conditions went on to surgery. The last technique that I'm excited to share with you is called NCR. NCR, or neurocranial restructuring, is a technique that focuses on the 22 movable bones in the skull. This is an exceptional technique for conditions such as temporomandibular joint, TMJ, chronic sinusitis, migraines, headaches, and concussion syndrome. If you would like to take action and get to the cause of your health conditions, please call my office at 813-788-0496, and don't forget to ask about our other disease-specific conditions.